This isn't just another health video. What if I told you there are hidden whispers your body sends, signals you might be overlooking right now, that could change everything? Ignoring them isn't an option. Stick with me, because by the end of this, you'll possess the knowledge to potentially rewrite your future. This insight, it's going to be the most powerful you hear today. Body's whispers. You know, it's a remarkable thing, the human body. It's constantly communicating with us, sending signals, subtle nudges, sometimes even urgent alarms. But in our busy lives with so much noise and distraction, how often do we truly listen? We push through discomfort, attribute new sensations to just getting older, or simply hope they'll fade away. This isn't just about prostate health, it's about a fundamental principle of well being, tuning into your own internal wisdom. For something as significant as prostate cancer, those whispers can become life saving messages, if only we're attuned enough to hear them. It's not about fear mongering, but about empowerment through awareness. We're talking about taking control, understanding the language your body speaks, and acting on that understanding proactively. Imagine the peace of mind that comes from knowing you're not just reacting to problems, but actively preventing them or catching them at their earliest, most treatable stages. That's the power we're tapping into today. This isn't about waiting for a crisis. It's about embracing vigilance and self-care as a way of life, turning passive observation into active health management. Think about it. How often do you truly pause and scan your own physical landscape? We're so good at noticing the big dramatic changes, but what about the slow, insidious shifts? The ones that creep up on you so gradually you hardly notice they're there until they've become significant. Prostate cancer, in its early stages, is often one of these silent invaders. It doesn't typically announce itself with a fanfare. It begins with subtle cues, easily dismissed or misunderstood. And that's precisely why understanding these early signs isn't just important. It's absolutely critical. It's about arming yourself with knowledge, turning potential blind spots into areas of acute awareness. This isn't about dwelling on what could go wrong, but about celebrating the power of early detection and the incredible opportunities it opens up for successful treatment and a return to vibrant health. We're talking about shifting from a reactive mindset to a proactive stance where you're the architect of your own well being, guided by informed choices and a deep understanding of your body's innate intelligence. The truth is, many men simply don't talk about these things. There's a societal inclination to tough it out, to avoid discussing anything perceived as weakness or vulnerability, especially when it comes to intimate health. This silence, however, is a disservice. It allows misinformation to fester, delays crucial conversations with healthcare providers, and ultimately can cost lives. My aim today is to break through that silence, to demystify these topics, and to provide clear, actionable insights that empower you to have those conversations with confidence. This isn't just about reciting a list of symptoms, it's about fostering an environment of openness where health discussions are normalized and proactive care is celebrated. We're building a bridge from ignorance to understanding, transforming apprehension into assurance. It's about creating a ripple effect where informed individuals then empower their loved ones, creating a community that prioritizes health, open dialogue, and early intervention. This is a movement towards greater well being, one conversation, one informed decision at a time. Urinary flow? Let's talk about something incredibly common, something many men experience as they get older, and often dismiss as just a normal part of aging. Changes in urinary flow. It's a classic, right? The stream isn't as strong as it used to be. You feel like you have to push a bit more, or maybe it starts and stops. We've all heard the jokes, maybe even made them ourselves. Oh, it's just my plumbing getting old. But sometimes these seemingly innocuous changes can be red flags, gentle nudges from your body that something more significant might be happening. While often related to benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, these same symptoms can also be indicative of early prostate cancer. The key here isn't to self-diagnose, but to recognize that any persistent change warrants a conversation with your doctor. It's about being an astute observer of your own body, noticing patterns, and understanding when those patterns deviate from your personal norm. This isn't about immediate panic, it's about informed vigilance. Consider the force of your stream. Is it weaker? Does it take longer to start? Do you find yourself having to strain to get it going or to empty your bladder completely? These are all indicators that the flow might be obstructed. The prostate gland, as you know, surrounds the urethra, the tube that carries urine out of the body. When the prostate starts to enlarge, whether due to BPH or a cancerous growth, it can compress this tube, leading to these very issues. It's a mechanical problem in essence. The body is trying to push fluid through a narrower opening, and it requires more effort or results in less efficient emptying. This isn't just an inconvenience, it can have downstream effects, impacting bladder health and overall quality of life. Recognizing these subtle shifts is your first line of defense, an early warning system that puts you in control. It's about empowering yourself with the knowledge to interpret these signals, transforming uncertainty into proactive health management, and fostering a deeper connection with your body's intricate workings. Another common complaint associated with urinary flow issues is a feeling of incomplete emptying. You finish urinating, but within a short time, you feel like you have to go again or you just don't feel finished. This sensation is particularly telling because it indicates that the bladder isn't fully emptying, leaving residual urine behind. This can be due to the obstruction we just discussed, or it can be a sign that the bladder muscle itself is struggling to overcome the resistance. Persistent, incomplete emptying can lead to other issues, such as an increased risk of urinary tract infections, and can significantly impact comfort and daily activities. It's not just a minor annoyance, it's a disruption to your body's natural processes. Paying attention to these subtle yet persistent feelings is crucial. It's about noticing the nuances, the changes that might seem small individually, but together paint a picture that demands attention. This level of self awareness is not just beneficial, it's truly life saving, guiding you towards timely intervention and preserving your long term health. Frequent urination. Moving from flow to frequency, another significant sign to pay close attention to is an increase in how often you feel the need to urinate, especially at night. Nocturia, as it's medically known, waking up multiple times during the night to use the bathroom, can be particularly disruptive to sleep and overall well being. Again, like changes in flow, frequent urination can have many causes, including simply drinking too much fluid before bed or other non prostate related issues. But when it becomes a persistent, noticeable change from your normal pattern, and especially when it's accompanied by other urinary symptoms, it absolutely warrants investigation. The prostate's role in this is clear. An enlarged prostate, whether benign or malignant, can irritate the bladder and create a sensation of needing to urinate more often, even when the bladder isn't completely full. It's the body's way of signaling an imbalance. Think about your usual nighttime routine. Do you typically sleep through the night without needing to get up? Or perhaps you get up once if you suddenly find yourself getting up two, three, or even more times a night, and this becomes a consistent pattern. It's a sign that your body is communicating something important. This isn't just about interrupted sleep, though that's certainly a quality of life issue. It's about understanding the underlying mechanism. The enlarged prostate can put pressure on the bladder, reducing its functional capacity, making it feel full sooner. Or the obstruction in the urethra can prevent complete emptying during the day, leading to a buildup of urine that needs to be expelled at night. These physiological changes are not trivial. They are direct indications that the prostate is undergoing changes that need medical evaluation. This is about being proactive, not reactive. It's about empowering yourself with knowledge, turning potential blind spots into areas of acute awareness, and safeguarding your future health with informed decisions. Daytime frequency can also be a signal. Are you finding yourself needing to locate a restroom more often than usual throughout the day? Is it interfering with your work, your leisure activities, or your ability to travel without constant worry? This persistent, increased urgency, especially when it feels like it comes on suddenly and intensely, can be another key indicator. It's not just about the volume of fluid you're consuming, it's about your body's internal signaling system. An irritated bladder or an obstructed outflow can create a constant sensation of needing to go, even if the actual volume of urine expelled each time is small. These are the kinds of subtle yet persistent changes that, when taken together, paint a picture that your doctor needs to see. Don't dismiss them as minor inconveniences. They are your body's way of gently, or not so gently, nudging you to pay attention. To investigate further, and to take action for your long-term health and well-being. Painful urination. Now let's address a symptom that often triggers a more immediate sense of alarm: pain or burning during urination, also known as dysuria. This is one of those signs that usually gets our attention more quickly than a subtle change in flow or frequency, simply because pain is harder to ignore. While dysuria is most commonly associated with urinary tract infections, UTIs, in men, it can also, in some cases, be an indicator of prostate inflammation, prostatitis, or less commonly, but importantly, prostate cancer. The key distinction here is persistence and context. If you experience burning during urination, especially if it's new, severe, or accompanied by other symptoms we're discussing, it's not something to just wait out. It warrants immediate medical attention to determine the underlying cause. Your body is sending a very clear, unambiguous message that something is amiss, and ignoring it would be a significant oversight in your health management. The sensation of pain or burning can vary. It might be a mild discomfort, a stinging sensation, or a more intense, sharp pain felt in the urethra or around the perineum. This discomfort can sometimes extend to the lower abdomen or even the back. The location and intensity of the pain can offer clues, but ultimately, it's a symptom that needs professional evaluation. It's also important to note if this pain is consistent or if it comes and goes. Consistent pain or burning, especially if it worsens over time, is a particularly concerning signal. We're talking about an internal alarm bell ringing, and you want to answer that call promptly. Early diagnosis, regardless of the cause, often leads to simpler and more effective treatments. This isn't about catastrophizing, it's about being responsive to your body's clear communication, honoring its signals, and prioritizing your well being with decisive action. Furthermore, sometimes blood in the urine, known as hematuria, can accompany painful urination. While seeing blood can be alarming, it's crucial to remember that it can be caused by many conditions, some benign, but it always requires prompt investigation. When combined with painful urination, it elevates the urgency of seeking medical advice. This particular constellation of symptoms sends a strong signal that something is definitively wrong within the urinary or prostatic system. Don't delay. Your health is your most precious asset, and symptoms like these are your body's direct plea for help. Empower yourself by acting quickly, by consulting with a healthcare professional who can accurately diagnose the issue and guide you towards the appropriate course of action, ensuring that any potential threat is identified and addressed as early as possible. Blood presence. Let's move on to a sign that often instills immediate concern: the presence of blood, either in your urine or in your semen. Medically, these are known as hematuria, blood in urine, and hematospermia, blood in semen. While both can have several causes and are not always indicative of cancer, they are significant red flags that absolutely must be investigated by a doctor without delay. Seeing blood in either of these bodily fluids is your body sending a very clear and unmistakable signal that something unusual is happening internally. It's an urgent call for attention, and ignoring it would be a serious oversight in your health journey. While it's natural to feel anxious, remember that early detection, even for concerning symptoms like these, vastly improves outcomes. Your immediate action is paramount. Hematuria, blood in the urine, can manifest in different ways. Sometimes it's visible to the naked eye, turning the urine pink, red, or even brownish. This is called gross hematuria. Other times, the blood is only detectable under a microscope during a urine test, known as microscopic hematuria. Whether visible or microscopic, its presence warrants a thorough evaluation. While it can be caused by infections, kidney stones, or other conditions, prostate cancer can also be a cause, especially if the tumor has grown to affect the urethra or bladder neck. It's a symptom that demands a systematic diagnostic approach to rule out serious conditions. Don't try to rationalize it away or wait for it to disappear. Your body is speaking unequivocally, and listening to that message without hesitation is a crucial step in maintaining your health. Similarly, hematospermia, or blood in the semen, can be startling. It might appear as a reddish or brownish tint in the ejaculate. While it is often benign, especially in younger men, and can be caused by inflammation, infection, or even vigorous sexual activity, it can also be a less common sign of prostate or seminal vesicle issues, including cancer, particularly in older men. The key is that any new occurrence of blood in semen, especially if persistent, painful, or accompanied by other symptoms, needs professional assessment. It's not a symptom to be dismissed lightly. Your doctor will be able to conduct the necessary tests and evaluations to pinpoint the cause and provide you with the appropriate guidance and treatment plan. This level of self awareness and proactive engagement with your health is what truly empowers you to navigate potential challenges successfully. Pelvic discomfort. Next, let's talk about more diffuse yet equally important sensations. Persistent pain or discomfort in the pelvic area, lower back, hips, or upper thighs. Unlike the specific urinary symptoms, these can sometimes be overlooked because they might be attributed to muscle strain, arthritis, or simply getting older. However, when prostate cancer spreads, one of the most common sites for metastasis is to the bones, particularly in the pelvis, lower back, and hips. Therefore, new, unexplained, or persistent aches and pains in these regions, especially if they don't seem related to injury or overexertion, should raise a red flag. It's not about jumping to conclusions, but about being an astute observer of your body's subtle shifts and understanding what might be driving them. This is about connecting the dots, even when they seem disparate. The nature of this pain can vary. It might be a dull ache, a throbbing sensation, or a more constant discomfort. It might be worse at certain times of the day or with specific movements. The key is its persistence and its lack of clear, benign explanation. If you've been dealing with a new pain in your lower back for weeks and it's not improving with rest or typical remedies, it's a signal that needs attention. Don't dismiss it as just a sign of aging or a minor niggle. Your body is a complex system, and pain is its way of alerting you to an underlying issue. While many things can cause back or hip pain when viewed in the context of other potential prostate related symptoms, it becomes a significantly more important piece of the puzzle that demands thorough investigation from a medical professional. This isn't about fear, it's about informed caution. It's also important to consider if this pain is localized or radiating. Does it feel like it's deep within the bone, or is it more superficial? While these distinctions can be helpful for a doctor, your primary role is to simply acknowledge the persistent discomfort and seek professional evaluation. Don't fall into the trap of self diagnosing or minimizing what your body is trying to tell you. This is an invitation to take charge of your health, to be proactive in understanding the messages your body sends, and to ensure that any potential concerns are addressed early when intervention is most effective. Your quality of life and future health depend on this vigilant and responsive approach to your internal landscape. This discomfort, if stemming from deeper issues, is a critical call to action that should not be ignored. Swelling legs. Another less commonly recognized but very important sign to be aware of is unexplained swelling in the legs or feet. This symptom, known as edema, might not immediately bring prostate cancer to mind, but it can be a sign of advanced disease. When prostate cancer spreads, it can affect the lymph nodes in the pelvis. These lymph nodes are part of your body's lymphatic system, which is responsible for draining fluid from the tissues. If these lymph nodes become blocked or compressed by cancerous cells, they can effectively drain fluid from the legs, leading to swelling. This isn't just a cosmetic issue, it's a physiological indicator that the lymphatic system is being compromised, and it warrants immediate medical attention. Your body is signaling a significant disruption that requires expert evaluation and intervention. The swelling might be noticed in one leg or both, and it can range from mild puffiness to significant enlargement. You might also notice that your shoes feel tighter, or your socks leave deeper indentations. Along with swelling, you might also experience a feeling of heaviness or discomfort in the affected limbs. This particular symptom, when it appears, often suggests that the cancer has progressed beyond the prostate itself, which makes early identification and treatment even more critical. Don't dismiss new or persistent leg swelling as just a result of standing too long or minor injury, especially if there's no clear explanation. It's your body giving you a direct message, and paying attention to these signals can literally save your life by prompting timely medical evaluation. This is about understanding the broader picture of how cancer can impact the body. Furthermore, sometimes blood clots can form in the legs, a condition known as deep vein thrombosis, DVT, which can also cause swelling. While DVT itself is serious, certain cancers, including prostate cancer, can increase the risk of blood clots. So, whether the swelling is due to lymphatic obstruction or a blood clot, it's a symptom that demands urgent medical attention. Your doctor will be able to perform the necessary tests, such as imaging studies, to determine the exact cause of the swelling and guide you towards the appropriate treatment. Being vigilant about such changes is a profound act of self care. It's about recognizing the intricate connections within your body and understanding that seemingly disparate symptoms can sometimes point to a single, underlying, and serious condition. This is about making informed decisions that safeguard your well being. Unexplained weight. This particular sign is often a common thread across many cancers, and it's something we should all be mindful of. Unexplained weight loss. We're not talking about losing a few pounds because you've started a new diet or exercise regimen. We're talking about significant unintentional weight loss without any change in your eating habits or activity levels. If you find yourself shedding pounds rapidly, say 10 pounds or more in a few months, without actively trying, it's a signal that your body is undergoing a profound metabolic change. Cancer cells often consume a lot of energy, and they can also release substances that alter your body's metabolism, leading to this kind of cachexia or wasting. It's a critical warning sign that your body is fighting a battle you might not even be aware of, and it warrants immediate medical investigation. Think about your recent history. Have you lost your appetite? Or are you eating normally, perhaps even more, but still losing weight? This discrepancy is key. When your body is fighting a serious illness like cancer, it can become incredibly inefficient at processing nutrients, or the cancerous growth itself might be diverting resources. This isn't about fitting into old clothes, it's about a fundamental shift in your metabolic state. It's your body crying out for help, indicating that something is profoundly wrong at a cellular level. Don't dismiss it as a welcome side effect of stress or a lucky break. While many benign conditions can also cause weight loss, when it's significant and unexplained, especially in the absence of conscious effort, it becomes a symptom that absolutely cannot be ignored. Your proactive response to such a change is crucial. This unexplained weight loss might also be accompanied by a general feeling of fatigue, weakness, or a lack of energy that isn't relieved by rest. This combination of symptoms, unintentional weight loss and persistent fatigue, is particularly concerning and frequently associated with underlying malignancy. It's your body depleting its reserves, struggling to maintain its equilibrium. These are not just minor inconveniences, they are systemic indicators of a serious health challenge. Empower yourself by observing these changes closely, documenting them, and promptly discussing them with your healthcare provider. This vigilance is not just about identifying potential problems, it's about giving yourself the best possible chance for early intervention and a successful outcome, transforming uncertainty into empowered action and proactive health management. Chronic fatigue. Finally, let's talk about something that can often be overlooked or attributed to our busy modern lives: chronic, persistent fatigue that doesn't improve with rest. We all feel tired from time to time, especially after a long day or a particularly demanding period. But when that fatigue becomes relentless, when it's an overwhelming exhaustion that permeates every aspect of your life and doesn't get better even after a good night's sleep, it's a critical sign to pay attention to. This isn't just about feeling a bit run down, it's about a profound lack of energy that can interfere with your daily activities and significantly diminish your quality of life. Cancer, including prostate cancer, can cause such fatigue for several reasons. It could be due to the body expending energy to fight the disease, the release of inflammatory cytokines, or even anemia caused by the cancer. Consider how this fatigue impacts your life. Are you finding it harder to perform tasks you once did with ease? Do you lack the motivation or energy for hobbies you once enjoyed? Is simply getting through the day an exhausting ordeal? This kind of fatigue isn't just physical, it can be mental and emotional too, leading to difficulty concentrating, irritability, and a general sense of malaise. It's a systemic drain on your vitality, a clear indication that your body is under significant stress. Don't just push through it or try to self medicate with more caffeine. Your body is sending a clear message that its resources are being depleted, and it needs a deeper investigation to understand the root cause. This isn't about blaming yourself. It's about listening intently to your body's profound communications. The insidious nature of chronic fatigue means it can creep up on you, making it difficult to pinpoint when it truly started or how much it has worsened. This is why self awareness is so crucial. Reflect on your energy levels over the past few weeks or months. Is there a noticeable, persistent decline that can't be easily explained? If so, this is a symptom that deserves the same level of attention as any physical pain or visible change. It's your body signaling a profound imbalance, a call for help that should not go unanswered. Empower yourself by acknowledging these persistent changes, discussing them openly with your doctor, and seeking the comprehensive evaluation that can uncover the underlying cause. Your well being depends on this proactive and responsive approach to every signal your body sends. Action plan. So, what do we do with all this information? The most crucial takeaway is this: early detection is your superpower. These aren't just a list of symptoms to induce fear, they are powerful tools for self awareness and proactive health management. Your body is constantly communicating, and learning to listen to its whispers and even its shouts is the most profound act of self care you can undertake. Don't wait for a crisis. Cultivate a relationship of deep listening with your own physiology. If you've noticed any of these changes or a combination of them, please do not delay. It's not about panicking, but about empowering yourself with knowledge and action. The simple yet powerful action plan is clear. Consult your doctor. Be honest and thorough about what you've been experiencing, even if you think it's minor or embarrassing. Your doctor is your partner in health, and they can conduct the necessary examinations and tests, from a simple blood test for PSA levels to a physical exam, to get to the bottom of things. Remember, most of these symptoms can be caused by conditions other than cancer, many of which are easily treatable. But only a medical professional can make that distinction. Proactivity now can save you immeasurable worry and potential health challenges down the line. Take control of your narrative, embrace vigilance, and champion your own well being. Your health is not just a gift, it's a responsibility to yourself, to your loved ones, and to the vibrant life you deserve to live. Being informed, being vigilant, and being proactive are the cornerstones of that responsibility. Don't let fear or complacency hold you back from taking action. Empower yourself with this knowledge, have those crucial conversations, and ensure that you're giving yourself the very best chance at a long, healthy, and fulfilling life. Listen to your body, trust your instincts, and always prioritize your well being. You have the power to make a difference in your own health journey starting today.